Hello. So I decided to do my site visit at an advanced physical therapy location. I found advanced physical therapy a few months ago through my mom, who was at the time actually getting physical therapy done as a result of a car accident. She had told me how nice the staff were to her, and since then I'd kept this place in mind for a place to shadow. There are currently 4 advanced physical therapy locations in South Jersey, owned by Robert Romolino. Rob graduated from Emory University in 2001 with a master's in physical therapy, and he opened the first advanced physical therapy later in the same year. Since then, Rob has developed the office to treat almost 10,000 patient visits per year while maintaining a greater than 99% customer satisfaction rating. I wasn't surprised to find that out since when I first called for an appointment, I wasn't able to get through initially, but around the same time the next day, I received a call from Rob, who was more than accommodating to my request of shadowing for the purpose of the site visit. When I came for the site visit, Rob wasn't actually in. I ended up interviewing 2 of the other physical therapists on duty, Paul Leto Jr. and Bill Roberts. Paul was the main physical therapist I interviewed that day. I found out that Paul had been a physical therapist for 18 years. He originally went to college to get a degree in business administration at Rowan University, which was called Glassboro State at the time. While in college, Paul worked for American Express and realized after working for them for 4 years that he'd wanted to do something more and decided he wanted to become a physical therapist. Since his undergrad was in business administration, he actually had to take science classes for a year and soon applied to go to Widener University for his doctorate in physical therapy. Bill was another physical therapist that was there at the time of the interview. I didn't get to ask about him as much as I was able to ask Paul, but I was able to find out that he has been a physical therapist for 20 years, and he actually has his master's degree in physical therapy. Both Paul and Bill were very kind and were nice enough to answer the questions I had for them. The questions I asked included what certifications were needed to become a physical therapist, what advice do you have for physical therapy students, what are some of the job duties that you perform on a daily basis, how much personal time do you spend doing research on a daily basis, and what are some qualities that you look for when hiring someone new. For certifications, they actually said that all you really needed was a doctorate degree in physical therapy. As long as you go through a pre-PT undergrad and get the doctorate, there's no requirement to become a physical therapy, since anything you would need would already be integrated into the program. If anything, volunteer hours were necessary, and those really ranged from 40 to 50 hours to 400 to 500 hours, depending on the school that you are applying to. Some of the advice they told me as a student was to be flexible and to check out the different aspects of physical therapy. Paul meant that being flexible was important because you have to be able to communicate and to be personable with a wide range of patients. Besides communicating, you also have to be flexible with hours, since currently there's a shortage in physical therapists to the point where you could be working 50 plus hours per week and not have a day off in weeks. Paul actually mentioned that he has had to work every single day for the last few Novembers. He joked that for some reason physical therapists just get lazy around that month, and he himself has gotten a good chunk of extra hours from working that month alone. Flexibility also comes into play when coming up with a program for your patients, since you have to work with what they're able to do at the time they come to you, and you have to get them to where they want to be with certain limitations. Bill mentioned that as a student, you should try and experience as much of each clinical setting as possible. Not only will it give you a glimpse of what the job could look like for you in the future, but seeing things in action could tell you something about yourself that you didn't know before. Personally, he didn't think he would do well with wound care, but when he got there, he actually enjoyed it. In addition, he also mentioned that getting experience in different settings can give you a slight advantage from other students applying for the same spot in a program. Some of the daily job duties for a physical therapist includes evaluation and diagnoses of different patients as well as treatments. Paul and Bill mentioned that paperwork takes up about 25 to 50% of their day, depending on whether or not documentation was computerized or not. When Paul worked at Kennedy in Washington Township, documentation was done manually and took up about 50+% of his workday. But at Advanced Physical Therapy, they use a program called WebPT. WebPT is a more accurate way of doing work, and it cuts the time in half since everything's computerized and you can just type everything up. When I asked about research, Paul said that he didn't really do a whole lot of research on his personal time. If anything, you just have to keep up to date on what's happening. There are blogs and physical therapy organizations that you could join to keep you up to date, he said. For my last question, I asked what qualities they look for when hiring someone new. Essentially, they both said that character is important. They want highly motivated individuals who are successful in their student clinicals. They want someone who does a lot for it and likes to be involved with their community since that's who they'll be seeing. And that way, they'll be able to bring in more patients who need help too. Some of the things I learned came from my line of questions, really. Other than that, from this site visit, I learned that I just need to put myself out there more. I still want to become a physical therapist one day, but I need to visit more settings to help me decide where I'd most enjoy working in the future. I also learned that getting a job as a PT aide could potentially help me prepare for the job as much as going to PT school would. Paul said that he learned just as much from working as an aide as he did in school, the only difference being that he got paid to learn as an aide. Something that appealed to me the most was the idea of being able to help transform someone's life. I could be the reason why someone has an improved living, and that alone is exciting to me. Something that really didn't appeal to me as much was the amount of days Paul mentioned working. I couldn't imagine having to work for 1 month straight without a single day off, although I'm sure he probably made a decent amount of money from that month alone. With all of that in mind, I would still love to become a physical therapist one day. These are just pictures I took at Advanced Physical Therapy of some of the equipment that was there. At the time of my visit, there were actually 3 patients. One of them was a girl around the age of 12 years old, and the other 2 were older adult men. At the time, the girl was on an exercise bike. I wasn't sure what her condition was, but I was just really surprised to see her at a physical therapy place at such a young age. The other 2 men were more typical. One of them was using bands, while the other, I believe, was using weights. And that's it.